It is Wellness Wednesday. In the sponsored segment this morning, we are speaking with Dr. Kamal Khorfan, a gastroenterologist at Memorial Healthcare Gastroenterology, to talk about GERD this morning. Thanks for coming on the show.
Thanks for having me.
Yeah, thanks for being here. Simply, first off, let's talk about what is GERD and the symptoms involved there.
So GERD is gastroesophageal reflux disease. It's a condition where there's an abnormal reflux or backflow of stomach contents and acid into the esophagus. And that can result in a number of symptoms and even complications down the line.
Yeah, talk a little bit more about those symptoms. So what should people be on the lookout for?
Yeah, so a lot of the symptoms a lot of people experience here and there. The main one that we talk about is heartburn, which is a condition where, or a symptom where somebody may have some chest pain or a burning sensation in their chest or throat, especially after eating or in the mornings. There are other symptoms as well, such as regurgitation or bringing up undigested or digested food. There are also less typical symptoms, things like voice changes or hoarseness or even coughing that's lasted for a very long time.
Well, and what are some of those things that contribute to GERD in the first place?
There are a number of risk factors for GERD, so things like excess weight, especially in the abdomen, pregnancy, certain lifestyle things such as smoking or alcohol use, and then there are certain medications that can contribute to certain symptoms of GERD. And then finally, there are certain structural things like a hiatal hernia or changes in the positioning of the stomach and the esophagus that can contribute to those symptoms as well.
All right, that's where you come in. When should someone go see a gastroenterologist, and talk about what you do?
Sure. So usually the patient or the individual will start out by seeing their primary care physician, and from there a lot of times the symptoms may be intermittent or less bothersome, and then from there, if they become more regular or the person develops symptoms despite medication use or a trial of medication, or they develop a number of things we call red flag or concerning symptoms, then typically they're referred to a gastroenterologist like myself to discuss further workup or treatment.
And talk about some of those treatment options. What will you do as far as guiding a patient through this process?
Sure. So usually we start with a very comprehensive review of the symptoms, how often they are, what they are, when they're happening. We go through the list of medications and see if anything can be contributing to that. And then we talk about optimizing the medical treatment, and then as well as optimizing lifestyle changes or dietary modifications. And oftentimes we may recommend that the person has an upper endoscopy or a scope procedure to check for any of those complications of GERD.
Well, and then just finally here, what's the importance of seeking out treatment? What are the risks involved if you don't treat GERD?
Good question. So that's the main concern we have with GERD. If it remains untreated for a very long time, there can be some complications, and those may include inflammation of the esophagus, which we call esophagitis. They may include causing or resulting in a stricture or a narrowing of the esophagus, which can make it hard to swallow food or even having food getting hung up in that area. And then the most concerning is that it can result in precancerous condition or even esophageal cancer if left untreated for many years.
But bottom line, there are treatment options.
There definitely are treatment options, yes.
All right, and we appreciate your insight. Our thanks to Dr. Kamal Khorfan, a gastroenterologist at Memorial Healthcare. There's more information on your screen, on a contact number and the website. We appreciate the discussion this morning.
Thanks a lot.